Sri Lanka has a long experience on primary healthcare services, where the first primary healthcare unit in Sri Lanka was established in 1926, long years back. Since then, the healthcare delivery, where we have three-tier system, government has more focus on delivery of healthcare services to the people through strengthening of primary healthcare services. So, when it comes to mental health, the recent reforms Sri Lankan government has undertaken to integrate and deliver quality comprehensive integrated care services to the people through the primary health care reform is the top priority of the government. And in that, of course, it's not only mental health, the NCD care, the palliative care, the rehabilitation and wound care and so on and so forth. Many areas have been integrated to the primary health care to ensure that the people of the community get the most comprehensive and quality care. We have a network of healthcare institutions when it comes to primary health care, over 600 in number across the country, and each 20,000 population has access close to their doorstep for the primary health care. Now, when it comes to the mental health, of course, we look at the mental well-being as the vision and the goal, and within that, of course, one side we have the psychiatric units attached to the tertiary and secondary care institution headed by the psychiatrist, and then of course going down to the primary health care institutions, we have medical officers who have completed their post graduation. A diploma program in mental health is heading this unit, and then of course we have nurses who have been trained in the mental health care delivery to the primary health care settings to people, and then of course the other healthcare staff like public health midwives are also being trained and engaged. So when it comes to the institutional care, as I said, we have the tertiary care institution, secondary care institution, and when it comes to the primary health care, it's more decentralized and headed by a medical officer of health and a nurse who have been trained in psychiatric care as well as mental health services, and deliver a care to the close to the people. But then going down to beyond that, institutions, of course, at the community level, public health midwives and the public health nursing officer who is attached and trained is going to the families. So through that, of course, Sri Lanka was able to deinstitutionalize the care, where majority of patients are now being treated at the primary and secondary care institutions and also at the community level. And we have teams set up headed by the medical officer trained in mental health as well as the community psychiatric nurse who go house by house and deliver what is needed by the people when it comes to the mental health care. So all in all, government of Sri Lanka has focused on primary health care, and in that, of course, mental health has been identified as one of the most important component. And going beyond the primary health care to the community level, again we deliver integrated care when it comes to mental health, when it comes to rehabilitation at the community level. So this is the vision of the government, and we are embarking much on this, and resources are being diverted on primary health care more and more as a policy by the government.